Hey there! Welcome back to Dr. Saalaar Channel, where we talk about health and wellness. This is Dr. Fatima, and today we are going to talk about a pain that you might have felt before, but you don't know a lot about: tailbone pain or coccydynia. So sit back, relax, and let's dive into it. First, let's talk about the anatomy. Our tailbone or coccyx is a small triangular bone at the base of our spine, and it can be quite sensitive. There are numerous reasons that you might feel pain in your tailbone, but here we are going to talk about a couple of these reasons and how to deal with it. The most common reasons can be trauma, such as falling, and extended sitting, especially when you sit on a narrow or hard surface. Imagine that your body is like a car. When you keep this car parked for a long time, the tires get flat spots. In the same way, when you sit for too long, certain parts of your body, like your back, your legs, and your circulation, can stagnate and not function as well. So you might ask, well, a lot of us sit at work for a long time. How long is safe? Most experts suggest that after each 30 minutes of sitting, it's better for you to stand up and move at least for a couple of minutes. This doesn't mean that you need to do a workout. Even just standing, stretching, or walking briefly can help. The idea is to break up those long periods of inactivity. Alright, now let's talk about how you might feel this pain. Many people feel this pain while sitting or transitioning from a sitting to a standing position. Your pain can range from mild to severe, and it can even come with symptoms like pain while having bowel movements. Alright, now that we know why it hurts, let's talk about how to deal with it. So here's what we're gonna do. Firstly, I'm gonna give you some tips about what to do and what not to do, and then I'm gonna teach you some simple exercises that you can use and decrease the tension in your coccyx area. The first tip is a good posture. Try to maintain a straight back and avoid slouching. Use cushion seating, especially coccyx cushions can distribute your weight away from your tailbone. The next thing that you should do is to stretch regularly, especially if you have a sedentary job. Alright, now let's talk about some specific and simple exercises that focus on strengthening the muscles in your pelvic area. These exercises can enhance blood flow, relieve muscle tension, and stabilize the pelvic and lower back area. The first exercise is called pelvic tilt. For doing this exercise, you should lie on the ground with your knees bent and your feet flat on the ground. Tighten your abdominal muscles, push your lower back into the floor, and tilt your pelvis slightly upward. This exercise can help strengthen your core and lower back muscles and align your pelvis. By doing this exercise, you can relieve the tension around your coccyx and ultimately reduce pain. The next exercise that you can try is child's pose. For doing this exercise, you should sit back on your heels from a hands and knees position. Try to stretch your arms in front of you and lower your chest toward the floor. This is a relaxation pose that stretches your lower back and helps alleviate your coccyx area. The next exercise is called deep glute stretch. For doing this exercise, lie on your back with your knees bent. Then cross one ankle over the opposite knee, hold the uncrossed leg, and pull it gently toward your chest. This stretches the piriformis muscle, which is located deep in your buttock and can sometimes be a source of coccyx pain. The next exercise is called Kegel exercise, and it's really easy actually. You just have to contract and then relax your pelvic floor muscles. You can do this exactly the same way that you try to stop yourself from urinating, and you can do this in every position: sitting, lying, or standing. By strengthening your pelvic floor muscles, you provide a better support for your coccyx and its surrounding area. In addition to doing these exercises, there are some other ways that can help you alleviate your pain, and one of these ways is to use heat and cold packs. Cold packs can reduce inflammation, while heat packs can increase blood flow and relax the muscles. After an injury or a flare-up, until 48 hours, you can use cold packs on the affected area. Apply it multiple times and each time for 20 minutes. After that, switch to warm packs and put it for 20-minute intervals to relax the tight muscles around the coccyx. These are some simple ways that can help you manage your pain, but of course, if your pain continues and is severe, you definitely have to go to a professional and ask for their help. That was it for today. Thank you guys for watching, and please don't forget to like, share, and subscribe. And I'll be really happy to see what you guys think about this video and answer your questions in the comments. Bye!